All right, Dr. Adami, you were explaining gum disease and the devastating effect of it and the different stages of it. Can you tell us the 3 or 4 different treatments which exist to A, not get an infection in the first place, or not get it worse, and of course actually take it away?
Well, absolutely. There are 3 different ways to handle it. The first way is just your general cleaning from your hygienist, done every 4 to 6 months, and that's for people who have very, very minor gingivitis where the disease is only in the gums. And just a very superficial cleaning around the gum line and a polishing along with your home care, being brushing and flossing, is essentially all you need to do. If you have full-blown periodontal disease where the bone is infected, well, then that superficial cleaning just isn't enough. The hygienist at that point, or the doctor, but very often the hygienist at that point needs to go deeper under the gum line, which can be painful. So we tend to give people Novocaine for that to make their mouth numb, so the hygienist can do a more adequate job cleaning out the bacteria that's way below the gum line. If it progresses past that into advanced disease, then we normally send our patients off to a specialist called a periodontist. And what the periodontist does is actual gum surgery, where in order to access the infected bone, he needs to peel the gum away from the tooth and the bone, clean things all out, and then sew the gum back up again. It can be very painful. It can be very costly, but it's avoidable if you take precautions and do the first 1 or 2 treatments properly. The fourth way to treat it is with antibiotic therapy. There are several good antibiotics, minoxidil being the most common, that comes in gels and little small chips that we can basically insert between the tooth and the gum, and over a time period of about a month, it releases the antibiotic and it can help kill the bacteria that's causing the infection. That's normally done in conjunction with the second treatment, with the deep scaling.
Okay.
Does that help?
No, it definitely does help. Now, you said that the third one, the periodontal surgery, is painful. Is it painful in the office or after, because it's a surgery, so when you leave the office, it kind of like has after effects of well, any, like most surgery, like whatever?
Well, that's a good question. It's normally not painful while it's being done because, of course, you have anesthesia in your mouth and your mouth is completely numb, so you don't feel what's going on. When you go home, though, you'll often experience some discomfort. We sometimes need to give you pain medication for that. And yes, it can be quite painful. It's sometimes difficult to chew for about a week or so after the surgery because the gums are sort of raw and tender. It's something that you want to avoid at all costs if you possibly can.
Probably a part of it because of the cost also, right?
Yes, it's not inexpensive work. It's done by a specialist, and yes, it can be quite costly. Helmut, I often tell my patients that I only treat 2 diseases. One of them is cavities, and the other one is gum disease. And both of those diseases are caused by bacteria. If you keep your mouth clean and free of bacteria and have a cleaning every 4 to 6 months and you brush and floss and see a dentist on a regular basis, you can largely avoid all of these problems.
Wonderful. Well, I have heard many, many times that dentistry is the most preventable entity in the whole medical field, period. Nothing else is as predictable preventive than dentistry. Do you agree with that?
I would agree with that 100%. What I do is extremely preventable. The only thing we sometimes can't prevent is trauma. That's why I tell people to wear their seatbelts, because that's the only way that if you keep your mouth clean, trauma is the only way that you can get hurt.
Well, all right. Thanks a lot, Dr. Adami.
You're very welcome, Helen.